must take this opportunity to thank Ilan for inviting me to be a part of this fantastic session with Dr. Eyal and for all the back-end support. I am Dr. Bhaggyashri A Pawar, practicing exclusive pediatric dentistry in Mumbai, which is the economic capital of India, also popularly known as the City of Dreams. Which till a few months ago was limited to a small Chinese province, has suddenly snowballed into a hydra-headed monster, rapidly swallowing up one country after another in its deadly jaws. The biggest of powers have been bewildered, and collectively, the human race seems to be on the brim of devastation, both economically as well as physically. If we connect the dots, we would realize that Mother Nature is telling us to sit back, reflect, and ruminate over the way we go about the business of life. This time, Mother Nature has shown all of us who is in charge. Dentists are more prone to infections in any outbreak like this because they are exposed to aerosols and droplets coming out of patients' oral cavity. The use of drills during dental treatment carries fine water particles in the air, which could carry the coronavirus for up to 3 hours. We dentists got another horrifying news that we are the most affected occupation. Dental care settings invariably carry the risk of COVID-19 infection due to the specificity of its procedures, which involves face-to-face communication with patients and frequent exposure to saliva, blood, and other body fluids. And of course, handling the sharp instruments. Just for little humor, this is Dwayne. We all know him. He's carrying a bag full of money after walking out of a successful movie. But after the daunting news of Corona affecting us, dentists all over the world started talking about the new dental guidelines. And that is exactly how I would be carrying my bag full of guidelines towards my office. And then, of course, few of us became like Sheldon with our obsessiveness of using hand sanitizers and washing hands. And I must say that some dentists have really outdone themselves by using the plastic wrap in each and every corner of their dental office. Pediatric dentistry is a unique specialty in dental profession because it is age and patient defined, not procedure defined as with the other specialties. Pediatric dental patients range from pre-cooperative infants to toddlers, children, and even teens, and may include individuals with intellectual or physical special healthcare needs. In all these age groups, there are those who are fearful, anxious, or angry, and therefore they are difficult to manage. The ability to guide the behavior of young patients has been the hallmark of pediatric dentistry, and acquiring the skills to do so begins during our specialty training. Behavior management methods are about communication and education. The relationship between the child's family, and the dental team is a dynamic process. It may start before the patient arrives in the dental office and can involve written information as well as dialogue, voice tone, facial expression, body language, and touch. No one method will be applicable in all the situations. Rather, the appropriate management techniques should be chosen based on individual child's requirement. This is the expectation that we have from all our patients, that they happily come and sit on the chair and they go smilingly out of the chair. And this is the reality what most of the patients or most of the doctors feel. I hope by the end of this session, we can turn your expectation close to your reality. Now, behavior management during COVID times has been a thing to it's something that we all need to think about. Before calling the patient to your dental office, make sure that you connect to the parents, since parental anxiety is closely associated with child's behavior. Strategies that aim to decrease parental anxiety may also improve child's behavior. Helping the parent to understand what will happen allows them to prepare the child and improves the treatment alliance. Preparatory information sent prior to first appointments produce improved behavior compared to children whose parents had not received this information. Also, some mothers have reported that this information was really helpful. And an unexpected benefit may also be in the reduction of the broken appointments. Parents can inform the dentist about events that has distressed the child in the past. This is especially important where a negative dental experience has been occurred. Also, during this lockdown phase, if the child has maintained a good oral hygiene measures regularly, the parent should inform the dentist so that the dentist will appreciate the child, which encourages the child to maintain the habit and also acts as a positive reinforcement. Thanks to technology, as I said, that we are just a phone call away, good communication is essential with all the patients if a good treatment alliance is to be formed. Reinforcers work best when applied directly to the appropriate behavior. Memory structuring is a behavioral approach in which memories associated with a negative or a difficult event are restructured into positive memories using information suggested after the event has taken place. This approach has been tested with children who receive local anesthesia at an initial restorative dental visit and has shown to change the local anesthesia related fears and improve behaviors at subsequent treatment visits. Memory structuring involves 4 components: visual reminders, positive reinforcement through verbalization, concrete examples to encode sensory details, and sense of accomplishment. A visual reminder could be a photograph of a child smiling at the initial visit. Positive reinforcement through verbalization could be asking if the child had told her parent what a good job she had done at her last dental appointment. The child is asked to role play and to tell the dentist what she had told the parent. Concrete examples to encode sensory details include praising the child for the specific positive behavior, such as keeping her hands on her lap or mouth open when asked. The child is then asked to demonstrate these behaviors, which leads to a sense of accomplishment. This is another important technique that we can use because the objective of this is to assess the anxiety that may lead to non-compliant behavior during treatment, teach the patient about the procedures using euphemisms and how they are going to get accomplished, and then confirm the patient whether he or she is comfortable with the treatment explanation or not. So this is basically a modification of the tell, show, do technique, which is called as the tell, play, do technique. This technique is basically using the concept of learning by doing by reducing the child's fear and anxiety to dental treatment and promoting adaptive behavior. So, according to this methodology, this technique is more efficient than live modeling. Now, we all know that live modeling in this COVID times is slightly difficult because we need to keep minimum people in the dental operatory room. So, this technique is an alternative to tell, show, do and live modeling technique. And this technique, believe me, is worth practicing in pediatric dentistry. One can also ask the child to play these online dental games before they come to visit you. Because these online dental games are, believe me, they are really addictive and they are really fun. One should try it. Make sure that you inform the child that the clinic is no more child friendly. There are no coloring books, there are no games, there are no soft toys. But make sure that you can, make the right use of technology and use some nice peppy or some really good nursing rhymes that one of the kids likes, or maybe some nice peppy songs. Some patients need their toy or favorite game. In some circumstances, this can be allowed with proper plastic cover, which can be disposed of. Make sure you call your patients in the morning slot because that is a time that kids are attentive and fresh. Now, when the patient walks into your clinic, there are no surprises for them. By now, your patient is well oriented with all your clinic policies and knows all the do's and don'ts in the clinic. To overcome the fear, the pediatric dentist must make efforts to establish an individual relationship with these children. I mean to say that you need to develop a bond at a personal level. This practice of developing interpersonal relationship assists in overcoming their existing fear and helps in creating a pleasant environment. Before any verbal communication with the dentist during the first visit at the dental clinic, the impression of the dentist is based on grooming, cleanliness, and attire of the dentist. Dentist attire is an interesting and important subject to focus on because it could be easily adjusted to the child's preference. I'd like to quote two studies over here. One of the studies, which was conducted in 2016, concludes that as a pediatric dentist, our role is to ease the fear and anxiety. The use of child friendly colors in attires may help in relieving the dental anxiety and aid in better communication. Whereas the study that was carried out in 2019 concludes that there has been a significant impact of dentist attire on the child's acceptance and dental procedures. And that's how few of our dentists became Superman. Some of them stuck really nice mermaid stickers on their PPE, and some wore really colorful PPEs. Some of them even stuck their photographs so that the patient can recognize them. And that is one of our dental COVID warriors wearing a customized name tag for easy identification. A few dentists came up with really cool shields. That's our very own Dr. Eyal in the first picture on the left-hand side. And we have the Wonder Woman shield, and we have some really cool smiling shields. And that's how I fabricated bee shields using the innovation in the right way. I want you all to know that our products are made out of sustainable material and they are completely biodegradable and recyclable. These shields were not only happily accepted by the pediatric dentist in India, but I was happy to know that the children are also positively and happily accepting it. Within no time, we were featured in many reputed and regional newspapers. Our mission of spreading smile this COVID was accomplished. Coming back to the behavior management technique, voice control. This technique is basically controlled modification of voice volume, pace, and tones to influence or state the child's behavior. It is specified for the uncooperative and distracted patient to gain attention and observance, avoid negative behavior, and establish authority. It is not used among children who, due to age, disability, or emotional immaturity, are incapable to understand or cooperate. Once the required behavior is achieved, it is waged and positively reinforced. Please appreciate at no time it should not be interpreted as being angry at the child. At this point, the patient is given a scale of control over the dentist's behavior during the use of stop signals. Such signals have been shown to diminish pain during regular dental treatment as well as during local anesthesia administration. The stop signal, generally raising an arm, must be rehearsed, and the dentist should act in response rapidly when it is used. The technique is helpful for all the patients who are able to communicate. There are no contraindications. Distraction intends to move the attention of the patient's attention away from the dental procedures. These are two very good studies that I came across, which were conducted in 2016 and 2018, which says the study that was carried out in 2016 says that the audiovisual distraction seems to be an effective method in reducing fear and anxiety in children during dental treatment. Whereas a study that was conducted in 2018 says that the audiovisual distraction technique was more effective in managing anxious pediatric dental patient as compared to audio distraction technique. This is the most important part of any dental procedures, the reward time. Kids completely look forward to getting their favorite toys, their bracelets, and fun balloons from the dentist at the end of the procedure. Let me take this opportunity to share this amazing experience of my patient that makes me, and I'm sure after watching this, I'm sure a lot of people will feel proud to be a pediatric dentist, is that this little champ had early childhood caries. He was facing speech difficulty due to early loss of upper anterior teeth. He was bullied in his class for looking old. The child was extremely low on confidence, was fearful in his initial visit. We had to use a lot of tell-show do along with a lot of TLC and audio-visual distraction and bunch of positive reinforcement. And at the end of his treatment, you can see him flashing that smile with confidence and doing his favorite floss dance. This little doll had a difficult past dental experience. She was too anxious to even enter the dental operatory. We had to use a younger sibling as a model, along with enhancing control technique, and it worked like magic for us. On her last visit, before entering the dental operatory, she slipped in this letter and gave me the warmest hug after I opened the door for her. The unexpected moment is always sweeter, isn't it? This little rescuer sent me this greeting during his COVID phase saying he will rescue me from the coronavirus and will take me to a safer place with his parents. He's a big Avenger fan. You guys shouldn't miss out on his haircut over there. Lastly, I want you all to strategize which techniques to use, how to use. Do not panic at all, and just very important, stay positive. Stay positive and stay safe. I would like to conclude this presentation by saying that the expertise in basic behavior guidance technique is critical to the continuing success of all of our specialty. And more importantly, the overall health of the young patients. Pediatric dentists must continue to master the ability to manage the behavior of young and difficult children in order to be best prepared to provide therapies that are grounded in science and to provide long-term solutions. Educators must make renewed efforts to teach basic behavior management and emphasize the critical role that it has in providing effective pediatric dental care. We recognize the place and the importance of advanced pharmacological behavior management in our specialty, and we are grateful for those options when we are truly needed. However, we are concerned that the pendulum has swung too far and that the children who can be safely and comfortably be guided with basic behavior management techniques to accept routine chairside dental care and become excellent dental patients throughout childhood and beyond are not given the opportunity. Pediatric dentistry specialists and other dentists who treat children must not dilute or abandon the unique techniques that have been the basis for successful clinical care for generations of children. Our patients and their parents are trusting us with this challenge. I would conclude this presentation with this wall of happy smiles, which I have been able to deliver without sedation and with all non-pharmacological behavior management. I would like to connect with all the wonderful audience that is present in this session. You all can follow me. You can write in your inquiries at this email ID. And thank you. Thank you so much.
Thank you very much, Dr. Bhaggyashri. Now we'll leave you with Dr. Simchi. Please, doctor, if you can share your presentation.
All right, sorry about that. All right, I'm Eyal Simchi. I'm a pediatric dentist in New Jersey in the USA. My lecture is really mostly when I do speak to people, I speak more hands-on versus lecturing. So I'm going to sort of run around in different places in the lecture a little bit. I called my lecture Pediatric Dental Sandwiches because I like to think of the way I do pediatric dentistry as little parts of a big process. So with the sandwich, there's the bread and the parts that you put inside the sandwich. But I like to try to make it, a focus on the big picture, but also a focus on the small parts as well. This is sort of where my process started. I don't have a lot of dentists in my family, and I actually hated going to the dentist as a kid. So when I got older, I decided that I was going to try to make it a little easier for my patients compared to how my process was when I was little. So for me, in terms of how I'm going to run this by, my lecture is not focused towards right now in terms of a Corona COVID situation. It's more how I do pediatrics, in general. It's sort of really a mindset of how I approach pediatric dentistry. When I was in dental school, they taught, a lot of techniques, and we did have a nice focus on pediatric dentistry, but not as much as I would have wanted. So over time, I developed different techniques, and I worked with different techniques that I learned from other dentists all over the place to try to come up with what worked for me. So my lecture is not specifics of, what to do in every situation, but more of a mindset that helps when working with children in general. I'm one of 10 kids. I have 6 of my own kids, so I've been around kids my whole life. The way I approach pediatric dentistry is as really 2 parts: the dental part, which is the clinical aspect, and for me, the more important part is the patient part. When I was in residency, my director told me to always remember that the tooth was attached to a person. So for me, that's sort of where I kind of get my influence from. So what I feel like starting is, in terms of behavior management, the most important behavior management is not to need behavior management. So instead of getting to a point where now you have to use all these different techniques, pharmacologically or not, I'd much rather try to avoid that process from the beginning. And for me, that means starting everything early. So dental home by age 1 is what the American Academy of Pediatric Dentistry recommends, in terms of just having your patients already know who you are from a very, very young age. And that helps twofold. It helps because, number one, they already know who you are, and hopefully they're starting off at a position where there's no significant issues. They're really just, meeting you. They're young. They may not be so thrilled, but they'll get used to your office and your environment. And also, if you're catching things early, it's always better to catch a situation before it becomes a big deal, and instead, have little things that you have to deal with versus getting a child into your office when they're already a little older with a lot going on, and then you sort of have to catch up a little bit. So ideally, the best behavior management is not to have to, manage behavior at all. I'm going to skip through this PowerPoint a little just because I didn't have that much time to weed everything out to make it a little bit shorter. So I'm just going to run through some of the things, but I'm going to try to stick to the more important part. So number one important part is really, for me, how you look at the whole process. So in terms of the sandwiching, I like to look at every step of my process as a pre-process, during the process, and then after the process. So you really want to look at the big picture that your patient is coming into your office, but you also want to see the process in that, before they come to your office, what's going on, when they're in your office, what's going on, and what are they going to remember at the end of the appointment. So for our office, my most important first step is a meet and greet. Generally, we do not see patients right away and start doing work. We try to kind of focus the beginning of the relationship with the patient as something totally non-scary, non-clinical, non-medical. Most of the time when patients come in, we meet them in the waiting room. Again, with the Corona situation, things have become a little difficult. But I have found that if you've already built trust, all the changes are not as difficult for the patients or for the parents. So, in the past, we would have parents come in with multiple children at the same time. We've limited that a lot, so there's much less people in the office. We're not spending a lot of time, if any time, in the waiting room. And because we already have a trust built and we already have a relationship with the parents and the patients, it hasn't been a big transition to changing things. And they really haven't gotten too stressed about it. So I do feel that meeting patients in the waiting room so that they see you sort of non-clinical is important. Unfortunately, again, with all the PPE requirements, it's a little more difficult now, but it's still worthwhile to try to have them see you in a non-clinical way, even if you're wearing all the PPE, just coming out to give them a prize. In our office, we do a lot of magic tricks, so just doing something that will kind of take the focus off. So, you know, we joke around, we give a lot of prizes, we do a lot of magic tricks. This is just a quick video of what our office looks like. We try to keep it really non-clinical looking. So let's see if I can get this video working. So we have a fish tank, we have, you know, tooth-looking chairs, we have computers and tablets, TVs, so they can look at it when they first come in. They're not coming into something that looks very, very clinical. It definitely is a waiting room, but it's more exciting. There are patients that have a hard time leaving the waiting room because they're having a lot of fun. So, you know, my focus is to try to get them coming into the dental office already thinking of something not scary and something that may be a little bit more fun. Here's, you know, a case with an example like that. This patient you can see on the top left was actually hiding under his brother's feet while his brother was playing because he was so terrified. And eventually we worked our way to the back, and, you know, you can see at the end, he jumped into my hands and he was my best buddy at the end. But it takes sort of a re-looking at the process and a new mindset in terms of not that you just have to, you're the dentist, you have to get whatever you want done and get it done. It's looking at the patient and seeing what their fears are, what their specific anxieties are, what their background has been. So that way you're not just jumping into a clinical picture without understanding your full patient. Because if you can understand the full patient and you can build a trust with them and they know that you're there to help them, it makes life a lot easier for them to continue the process with you. In general, kids that have had previous trauma, this patient definitely has had previous trauma. He's had a much harder time at a dental office before he came to us. I think, as far as I remember, he was actually papoosed at some point. So he didn't really trust dentists at all. But the more you build their trust, the more you'll change from their previous experiences, and the better possibility you have of continuing in a positive manner. Here's just a quick, you know, look. When I do things with my patients, I try to pay attention to how they see it from their side. So with all the new PPE, I look in the mirror every time I put something new on and see how I can make it look a little scarier, less scary, because if you look at it like this, I look like, you know, a bad guy from a Batman movie. So I generally try to limit, you know, the scary looking things. Even, you know, before COVID was going on, I try out different tastes on myself before I try it on my patients. So sort of getting an idea of what your patient is going through will definitely help you as well. So that way you know what they're feeling, so you can try to counteract that, you know. So for us, luckily I had some masks with funny faces, and that just covers over the scarier mask. Since then, we've gotten a bunch of different things in the office to try to make everything look a lot less scary if possible. Here's just a cute slide. This is not the best way to wear PPE, but my daughter decided she wanted to go for a walk and the mask was a little big on her. So just the takeaway for this, for Corona, Dr. Bhaggyashri really covered a lot of the aspects, so I'm not going to go into, you know, the changes that we're doing now as much, and really I'm just going to discuss sort of an overall picture of how I look at pediatric dentistry. So here is, I'm going to skip some of the videos because, again, that's going to make this much longer, but just here's a quick video of a nervous kid in a waiting room, and this patient didn't originally want to spend much time talking to me, but when she saw a magic trick, it changed, you know, her view of me a little bit, and that was able to get her focus off of her fears and more towards the less scary parts of the process. So with that video, basically what I'm trying to do in the waiting room is I'm trying to get their focus off the fact that they're scared, that they've been to a doctor before and they're nervous about doctors, and I'm just another doctor that they may be scared of. And instead, if you interact with them and you make something fun, then it takes the focus a little bit away from that scariness, and it kind of calms them down, lowers their heart rate a little bit, and that gives you the opportunity to then explain what the next steps are. I like what Dr. Bhaggyashri was saying about explaining something to the patient, asking them what their fears are, explaining what's going on, and then asking to make sure that they're, understanding, which is a really important tip because it means that you're communicating with them. I do remember when I was a kid, I went to the dentist and there wasn't much of a discussion. It was just, you're at the dentist, whatever the dentist says you're going to do, and that was it. And I do find that patients really, really appreciate and really work well when they realize that there's a communication, that there's somebody listening to their fears, and somebody who will kind of work around what you have to work around to make it a little more comfortable. So what we generally recommend in the initial appointment is a discussion beforehand, even with the parents, to prepare them. There is something in the literature called a functional inquiry. The functional inquiry includes these questions. It's a little long, and I don't usually ask all of these questions, but it's just trying to get a background on your patient. So number one, have they had any past medical procedures? And if they have, how was their behavior at the pediatrician if they had anything going on? So you'll get an idea of just in general how they reacted to a clinical environment. An important thing as well is a child's perception of their health. If they feel like there's something wrong, for instance, if they have pain, it's much more likely that they're going to be stressed out and nervous when they need to get it fixed. So that plays back on trying to get them to the dentist as early as possible, because then you can try to get to them and help them before there's a major issue that's already causing stress. A major indicator that I find as well, and there are studies that show as well, are parents' anxieties and fears. If a parent is nervous, even if they are not telling their child that they're nervous, the child's gonna know that they're nervous about it, and they're gonna sense what's going on. So if a parent already comes into your office and the parent is all scared and nervous, I generally tell the parents away from the children that when you take them to go buy shoes or you take them to the grocery store, they don't see this fear and this nerve, the nervousness from you. So at the same time, you want to try to let your child know that this is similar in terms of, it's just another thing that you're going to experience, and it's nothing that you have to be scared about. And then the last question is parents' expectations. So really, parents know their children usually better than we do. So asking the parent how they think the child will do will prepare us. If the parent says that, this child is terrified of everything, you have, an idea of the direction you have to go, versus a parent who says, my child has, had experiences before at the dentist and they've been fine. So, it just gives you background information. So really preparing yourself and preparing your patient is a really, really important step. I generally don't go through that full functional inquiry. I usually just ask the parents quickly, has the patient been to the dentist before and has it been stressful? How do you feel about going to the dentist? And I like a question that isn't asked on the regular functional inquiry. I usually ask them if there are specific sensitivities that the patients have. So for instance, in the autistic population, patients with autism oftentimes will sense things much more severe than we do. So if there's an annoying sound, to us it's annoying, to them it may be not even something they can deal with. And each child and each patient has different sensitivities. There are some children that don't mind if something's uncomfortable, but if something smells bad or tastes bad, that's the end of the story for them. So again, preparing yourself as the dentist beforehand to get all the information you can will make the next step of the process a lot easier. And again, that's why I feel like, it's not just the big picture you have to look at, it's each individual component of the picture, so you can get an idea of what's going on. Just for the last slide, this is sorry about that. This is the picture that they usually put when they sell papoose boards. This is really how children usually look if they're in a papoose board. So again, if we're able to, avoid more difficult situations, it's always better for the patient, it's always better for the parent, and it's definitely better for the dentist as well. Here's another situation where, again, preparing and starting slowly instead of just jumping straight into the, into work was very helpful. This patient had been, very nervous at the pediatrician. When he came into our office, he just lied down on the floor and decided he wasn't even going to come in at all. And as we worked with him little by little, I found out from his mom things that he likes, and he liked bubbles. So we blew some bubbles, and that got him to come off the floor and walk slowly to the room. And eventually he actually got into the chair and sat up and had his teeth cleaned, and we finished with a chair back and a high five. So what I am trying to convey from this is that a few things. Number one is that you don't have to give up right away if you see that a child already is having a tough time, because there are ways you can get past those tough times. It's not automatically a failed appointment if they come in already crying. If you're able to build a trust and kind of distract from the situation, it's a lot easier to eventually build your trust and work your way towards, you know, getting whatever you need to get done. A lot of people know that I do magic tricks at the dental office. I'm not a great magician and I don't love magic that much. It was actually just a tool that, you know, on the advice of my wife, I got to try to build communication with my patients. I had seen somebody do a really, really cool trick, which is the trick that I do with the light. And it was amazing to me. And that was pretty much going to be the end of the story. But my wife told me to buy it because she figured if I was working with kids, it would be, you know, a great addition. And that really started the process. And you know, the real focus of magic is actually taking focus away. It's really distraction, which I feel like is really the focus of pediatric dentistry as well. It's really distracting from something that may be scary or difficult and putting the focus on something that's more exciting. Just like, you know, with magic, you want to distract them from what you're hiding and show them something that's exciting. Pretty much it's the same thing. We're not really hiding something scary. We're trying to distract and explain to them that it isn't scary. So we're really just trying to change their perception of what is happening in a dental office. And for that to happen, it's just really important to be flexible. So, you know, when I was in dental school, we were taught a lot of procedures. We were taught a lot of things in different steps. And they were, you know, if this A happened, then you have to do B. If B happens, you have to do C. But I feel like being flexible is a very important component of pediatric dentistry because not everything goes how we want it. With adult patients, you know, you have clinical changes. So if you think that you're just going to do a filling and it turns into a root canal, you know, that's your next step. With the pediatric patient, that is very important, but it's not as important as the actual patient's experience. Meaning, it may be that you're doing everything correctly and you're following all the steps, but if the patient tasted something they didn't like and you weren't prepared for that and they jump out of the chair, you have to be flexible to now figure out how to get that process back without it being traumatic for the patient or for yourself. So being flexible is the next really, really important step. So step one is sort of gathering all the information pre-appointment and being flexible with what you're going to be doing is very important. So in our office, we actually don't do cleanings on patients' first appointment if they're scared or nervous or crying. We try to keep the appointment super, super short. So really just give them prizes, give them balloons, get them used to the environment, show them around the office a little bit, but we really try to avoid doing anything that may make them more nervous. Here's a quick video I'll show. I'm not going to go through the whole thing, but I'll give you a little background afterwards. So this patient's mom is actually the daughter of a dentist. Her dad had passed away, but he was a very, very non-invasive dentist, and mom was looking for a dentist who wasn't going to be very invasive. He was only 3 at the time, and multiple dentists had told mom that he had to be put to sleep under general anesthesia to fix his teeth. And you can see from his x-ray, it's not the clearest picture, but he had a lot going on. And he actually, because of his previous experiences with dentists, wouldn't even come back to the treatment area at all. So in that video, he's actually getting his cleaning done in the waiting room. We try to make appointments closer to lunchtime for kids that are very nervous, so that way we can have, you know, the entire office just for that patient. It's not always possible to do that, but if it is possible to schedule at a time where it's quieter, it's easier to deal with more fearful, fearful patients. And this patient actually ended up with a very big treatment plan, but he ended up with everything fixed. And none of this was done with sedation. And, you know, we don't hold kids down. He wasn't crying throughout all of it. And this is him afterwards. He's, you know, always asking his mom when he gets to come back. So being flexible in terms of trying to do things a little differently. So instead of forcing him to come back into the back treatment room, because that's what we really needed, instead of being flexible and, taking a look quickly at his teeth in the waiting room so we could build a little rapport, build a little trust. Mom had prepared him beforehand about what was going to be going on, so he was a little open to it. And even though he was nervous, eventually he worked his way back to the treatment area and then got everything that he needed done with no fears, and no tears. These are just more examples of being flexible. This patient is great and happy, but terrified of sitting back. So we do his cleaning sitting back. Now, a lot of people have asked me, you can't really continue doing treatment this way. And if you're allowing the patient to get away with it in some way, they may, insist on continuing that way, but it really hasn't been my experience. I have found that when patients see that you're working with them, generally they'll build a trust. And right now he's been our patient for years and he sits back in the chair with no problem. Instead of forcing the issue at the beginning, if you can kind of work past it initially and build a relationship with the patient and an understanding that you're there to help them, most of those things that they're scared about and most of the fears kind of disappear. Here's another case. She didn't want to go on the chair at all, so she went on my chair. And we worked that way. This is just the type of behavior management that we don't recommend. It says, here's the deal. If you cooperate with me, you get the good boy drill, jerk me around, and you get this one. So, old-time dentistry was a little more aggressive in my opinion. There were more sort of negative options for behavior management. I do find that these days especially, I can't tell you from back then because, luckily I've never done them, but it doesn't work well, and especially now it doesn't work well. Parents don't really want that. Every country has different personalities and different, ways of looking at things. Even in the US, different communities look at things differently. In our practice, we try to keep everything as positive as possible, and that's very, very helpful. Here's another picture of something that we don't recommend. And one more. So dentistry has definitely evolved and changed over time. And I do find that changing to a more positive way does take more time initially, but it can actually save you time over the course of their treatment and their years with you as your patient, because now there's a trust built, so you don't have to worry about every time they come in, it's going to be more of a difficult situation where they're scared or fighting. So, you want to try to focus the pre-part of the appointment as something positive in the waiting room. You want to try to keep the appointment part of it, as something that there's an understanding between your patient. And then also when they're leaving, you want it to be exciting as well. So this is the next part in terms of during the treatment, the same thing. You want to sandwich it as something really fun. In the middle, you'll have to do the treatment. So you want to try to get that as, quick, simple, non-invasive as possible, and then something fun for them to remember afterwards. So it's very important to remember that what the patient last deals with is something that they're going to have in their mind more. So even if they did have a little of a difficult time, if they didn't like how something felt or how something tasted, and they weren't thrilled with the procedure that was being done, if you can try to keep their focus after the process off of that. So I actually have an associate who trained as a medical clown, and she does great medical, she does great dentistry, but she also does great balloon animals. So that's something that the patients like a lot. We give out a lot of prizes. Magic tricks are very helpful. So anything that you can do to try to keep the pre a little more exciting and the post a little exciting kind of sandwiches the thing that they don't like as much in the middle, and it's easier for them to forget that. So for me, my big focus is trying to keep my patients' focus off of the dentistry and sort of distracted from that. Here's a quick video that I'm going to skip, but the point of this video was, again, this patient initially wouldn't even let me look at her teeth at all. We slowly worked our way up towards counting her fingers, then counting her nose and counting her ears, and eventually she allowed me to look at her teeth, and we were able to continue and complete the exam and a cleaning without her crying. And when she came in the next time, she was a lot less nervous because she had already experienced what was going on. So if I would have pushed her to be on the seat initially, it would have been a little more difficult because, it would have started the whole process in a negative fashion. So prizes are also super duper important. Again, if there's something that they can take home with them, I've had parents tell me that the patients keep those prizes for months afterwards. You know, it doesn't cost us that much money to have, but it is something that they, you know, feel is really important. You know, we explain to the patients that they earned it, so it's something that they really worked towards. And again, the better the prize that you can afford, the better it is for the patients. Here's an example of a cool balloon animal that my associate made with me. So again, these are things that they take home and they keep their focus on that versus keeping it on the fact that they're numb, or that their mouth feels funny, or that something tastes bad. It just really keeps a more positive note to it. This I'm going to skip as well. This was just a quick magic trick that we did after the appointment that she was very excited about. So if anybody's still awake, this is actually a patient that was worked on. We did a crown on her with no sedation, and she was relaxed enough that she fell asleep. And the reason I show this picture is because that was her when she was about 4 years old, and now she's about 16 years old, and she's still my patient. Actually, 3 practices past where we originally worked together. So she followed me to multiple practices where I worked, and is now still my patient in my practice now. And that's something that I find as also a benefit to building trust with patients and families, is that it's very good for your practice in general. It's not just great for your patients, it's great for you as well. You know, when parents see how much you put into helping out their children, they're much more likely to want to continue staying with you. They're more likely to, you know, recommend other people come to you, and, you know, it's less stressful for your practice because you have people that are already trusting you, and you've built sort of already a family with your patients and your practice. So I'm not going to discuss clinical things very much, just because I'm going to probably eventually run out of time. But I'm going to just discuss pretty much the behavior management part of the clinical aspect without the actual clinical part of it. And so the important thing that I find is multiple things during treatment. So these are just a lot of different tips that can help when doing treatment on children. So the number one thing that I find with everything is managing expectations. So start the process with them already know what's going on. Dr. Bhaggyashri also discussed this really well in terms of allowing the patient to know what's going on beforehand. So that helps them already not have the fear of the unknown, because it's not as much unknown. You know, she was showing the little games that you can play, the apps that you can play online. That's also definitely helpful. The way a lot of people have found us is because we started posting videos of what we do online, so parents can show the patients, you know, this is what the doctor looks like, this is what the treatment looks like, and they get an idea. And, you know, multiple parents have told me that their children are excited to go to the dentist, even though they've never been there before, because they've seen these videos, and they see that it doesn't have to be as scary. So managing their expectations is definitely very helpful. You want to earn and keep their trust. So, you know, the technique of raising your hand if you want something to stop is something that's really important to keep to. You know, in our practice, even if a patient does it many times just as a game, we will stop each time, just so they realize that they can trust that if we say we're going to stop, we're going to stop. The next thing that's really important is not disregarding a patient's fears or feelings. I do feel like earlier in my career, it was easier sometimes to explain a patient's behavior if they weren't behaving so well, as, you know, they're a child and children are nervous and children act up when they're nervous. But sometimes there's a very specific thing that's bothering them. And if you can get them to explain that to you or figure it out yourself, it may not be so difficult to fix that problem very quickly. So I do feel like there are times where when somebody's working on a patient, the patient is as numb as you think they should be. You've given them local anesthetic and you're assuming that they should be fine, but they're still fidgeting. There is the possibility that they're still feeling pain, even if we think they're not. Sometimes there's accessory innervation. There are some patients, there are even studies that show it, that patients with red hair sometimes need more anesthesia and can feel more pain. So there are different patients that react differently to different things. So it's really important to not disregard it as, you know, it's just a child talking. It's important to realize that there are specific things that may make it more difficult for them. And if you can address them, that will definitely help as well. Tell, show, do is one of the most well-known pediatric tricks. It works beautifully. Modeling is great also. But again, now with Corona, it's a lot more difficult to do that. But I do feel that you can do online modeling if you do have videos of, you know, treatment being done. Parents can show patients those videos so they can get an idea. You know, they can watch an older sibling. Sometimes we even have them watching another patient if the parents and the patient are allowed, you know, okay with that and they allow it. But all those things will make your treatment appointments a lot more smooth and a lot easier to get into. So instead of it being a fight to try to get everything done, if you do enough of the preparation beforehand, the actual treatment appointment can be a lot easier. Here's just a quick tell, show, do situation where this patient was nervous. Basically gave him some gloves and a mask, and he became the dentist for a little while. So we show him a typodont and give him a little cordless drill, and he was able to drill his own, you know, cavity on a fake tooth and get an idea of what was going on without it being as scary because he can actually see what's going on. Here's another case of modeling. Again, unfortunately, these days we can't have patients so close, but these are pictures that we can show and videos that we can show to other patients so they can get a better idea of what's going on. Here's two patients that wanted to watch the same movie, so they got to sit. These are siblings, and they wanted to sit next to each other. Another case where, you know, the child sat on my associate's lap and helped work on her brother's teeth so she wasn't so nervous. Another sibling. So these are all things that definitely help, because when a patient can see what's going to eventually be done to them, you know, right in front of them, it makes life a lot easier. Here's a patient with me being the model. The next part I'm going to run through quickly just because I don't want to go to overtime, but this is just something that works very, very well, which is creative wording, or as Dr. Bhaggyashri called it, euphemisms, trying to take any scary words out of your sentences and replacing them for stuff that's not as scary. So instead of ever telling a patient that this may be painful or this may hurt, or tell me if something's hurting, I ask them to tell me if something bothers them or something's uncomfortable, so that they don't have that sort of idea in their mind of pain. Drilling has sort of a negative connotation. It sounds a little scary. So we just call the drills different things. We call them either the bumpy guy or a fire engine that makes noise. You know, we don't call a shot ever. We call it sleepy juice. There's a lot of different wording that you can use, and everybody will have to, you know, switch them to languages that work for them. But just changing it from something that may seem a little scary and try to change it to something that may be more exciting is very helpful as well. So during treatment, again, I feel like the most important part of actually the clinical treatment is the preparation. During the treatment, you know, again, you want to try to make sure that you're not actually causing pain. So you have to make sure that you're as confident as you can be, that if they are numb, they're as numb as you need them to be. And don't just assume that if you gave them local anesthetic, they're numb enough. You also want to make sure that, you know, you're not lying to them. If you think that something may be uncomfortable, preparation and explaining to them is definitely helpful as well. And you need to be flexible. So it's really important that if you decided that you were going to do something, but a patient sort of is not okay with it, or you're not able to control the situation, that you know, for a safe treatment, you have to have a plan B of what your next option may be. So either a temporary filling, or, you know, giving them a little break, trying to make sure that you don't get emotionally involved and, you know, come across as that you're angry at them. You want them to realize that you're there to help them, so that you can keep that trust going, even if the situation is not ideal. And then again, more magic tricks. So magic tricks for me, there's never too many of them. Almost every single patient loves them. And it's something that just kind of separates you from just being, you know, a dentist, doctor type of person that may be a little scary. It's, you know, they get very excited. There are lots of patients who are, you know, anticipating their next appointment just so they can see more tricks. We even have patients come in to try to show me, you know, magic tricks that they've learned just because it's so exciting for them. Here again is just a case. So I'm not going to keep you through the entire video, but basically he was terrified to come into the room or the chair. So we actually started his filling standing up behind the chair. And then eventually you can see he's in the chair, he's smiling. There's no anesthesia, no restraints, there's no fear. It was just a slower process at the beginning, but that over time kind of moves the process along a lot easier, because he's now not as scared as he was when he first came in. Here's another case where I did, you know, stand-up dentistry. Again, it's not conventional, but it works, and it's not something that you have to worry about happening all the time. It's just something that we do at times to kind of work our way past a more difficult situation and be more flexible again. I'm going to skip through this. This is just a funny situation that I had, and this relates to perception in pediatric dentistry. Again, that's more discussing sort of like the wording, trying to change how the patient looks at things from a scary thing and distracting them again from the scary part to something that's not as scary is really just in their mind. And this is just something that when I was in residency, this was a patient who wanted to have laughing gas, and we actually didn't have laughing gas. The tanks were empty. So when he came into the office, he was already crying that he wanted laughing gas. I asked his mom if she was okay with me trying some, little tricks, and she was happy with that. And this is actually how we performed all the treatment with the tubes attached to nothing because we didn't have anything to attach them to. So he actually did well throughout the entire appointment. He thought that he had laughing gas, and it was just that perception in his mind. And he sat and did beautifully throughout the entire thing. So being flexible is really what's going to make the difference. So that pretty much covers the behavior management. There's some, these are just more clinical type of things. I think I'm going to stop it at this point, just so that way it's not too long. And I know that Elon, again, thank you to you and Federico for making this happen. I know you had said that we can do a question answer session, so I'm fine with, if you want to do that now.
Thank you very much, Dr. Simchi. It is a real pleasure for us to have you from USA and Dr. Bhaggyashri from India joining us today in this class. So
Thank
yes,
you.
we have some questions. They are for both of you, so you can answer them together or as you want.
Sure.
First question, how do you feel about using aromatic sprays to calm anxiety that the patient is in?
So personally, I think that it is something that can work. There are different, scents that can be calming. We don't do that in our office, but what we do is we try to keep our office not smelling like a typical dental office. I'm actually an adult and I don't like going to the dentist. And if I go into an office that smells like my dentist's office smelled when I was a kid, it already gives me anxiety. So we just try to keep the office, we've had people come in and say, wow, it doesn't smell like a dental office. And that's what we try. I guess a good thing that's coming out of the COVID situation is that everybody has air purifiers now and different, things that they're doing. So most offices are not going to smell very dental, but I don't personally use them, but I think that there's a possibility that it can be helpful.
Perfect. Dr. Bhaggyashri, anything to say about that?
Honestly, I haven't come across something like that. And as Dr. Eyal said that our operatory is extreme. It's not usually like a dental office, which typically gives out that zinc oxide eugenol or any kind of distinctive smell. So our dental office is very well ventilated. So I don't personally use, and it's all, I don't think I have heard also something like that about that using any kind of aromatherapy. So I have no idea, but I think it should work.
Okay, thanks. Next question, what would be the best approach for a pediatric patient that requires emergency dental treatment?
You want to answer first? You want me to answer first? Either way. I can answer first. In our practice, it really depends case by case. I try not to make a lot of rules. So it really depends on what the emergency is and depends on the age of the patient and depends on their anxiety level. So it's really case by case specific. So, if you're asking specific to, now when it's harder to get into offices because of the virus situation, when we were closed, we did teledentistry. So we had parents call us and we would do a Zoom session or a WhatsApp session on the phone so we can get an idea of what was going on. And then if it was something that we could deal with over the phone versus, with antibiotics or with, anti-pain medication, stuff like that, then we would just deal with it over the phone. And if it was something more involved, then we would actually open the office for them for that emergency.
That's right. I completely agree with him. And most important, as a pediatric dentist, you need not panic because the kid and the parent are already into shock state. You need not panic. In fact, just strategize it, as I said, and handle it with utmost care.
Absolutely.
Thanks. Next question. How do you manage a kid who's scared and having dental pain at the moment of the first consult? It's like similar to the last one.
Yeah. So basically, what I used to do pre-COVID is I used to give the patient a dental tour, what I usually call, and try and show the patient how child-friendly our dental operatory is, and make him use all the drills, the three-way syringe and everything, take a basic x-ray and just send him back home. So the next time when the patient walks into my practice, he knows everything about the whole chair and how the chair goes up and down and how there's air spray and all the magical lights they switch on and switch off there with just one just one hand movement. So kid completely look forwards to the next visit, and that's how I deal with such a scenario.
Right, I agree with that completely, because I do find that it's much easier to try to introduce them to everything and kind of work with their fears. If you just jump straight into doing treatment, you're much more likely, well, two parts. Number one, from the patient's part, psychologically, it's much more difficult because they're already stressed out, they're already in pain, so the entire appointment is going to be more difficult, and especially if that's their first experience with you, and now it's already negative just because you have no other options. You're stuck with that. And from a dental perspective, if they do have an active infection, it is oftentimes harder to numb them. So it actually may be a more painful procedure just because of that. So if it's something that's, a trauma-related emergency that we have to deal with on the spot, then sometimes, it's a compromise, but it's what we have to do. So we try to make it as positive as we can and, load up on toys. But if it's something that we can, do like Dr. Bhaggyashri was saying, try to just get them used to us initially, especially if they do have an active infection, give them some antibiotics if it's indicated, to try to get the pain away and buy yourself some time. That next appointment will be much, much easier versus if you would have tried to do it the first time.
Perfect. Thank you very much. Next one. What is your, how do you deal with some painful anesthesia procedures? Mandibular anesthesia, for example.
So try not to make it painful, but I'll let you speak first, sorry.
No, absolutely. I completely agree with him. Distraction works best, and TED Show 2 works the best. The best. And a lot of storytelling when you're doing it. Storytelling, audiovisual. The kid completely sits through the mandibular anesthesia, and it's not painless at all, believe me. As Dr. Eyal said before we started our conference, there are a lot of patients who know me, and because of the skillful hand that we have, because they have a perception that when we can give a painless local anesthesia to a child, our hand is really skillful and delicate. And that's why I get a lot of requests that, doctor, I'm an adult, but I'd like to have a local anesthesia administered by your hand. So that's the kind of skill we develop in due course of time with experience.
Yeah, I think what's important is also, again, two aspects is the skills definitely in trying to make it as painless as possible. But what I also find helps a lot is also preparation beforehand. So not just going in and getting the patient numb, explaining what it's going to be, because I do find that a nice percentage of the population will deal well with the actual administration, the actual injection part of it, but they hate the numb feeling. And personally, I hate the numb feeling. So if you get a patient numb, even if you do it painlessly, but they don't know what to expect and now their mouth starts tingling and feeling weird, they may just get really, really stressed just from that, even if there was no pain involved at all, because it's an uncomfortable feeling that they didn't really realize was going to happen. So just preparing them beforehand about what they may feel, and also giving them, like Dr. Bhaggyashri was saying before, an option to stop the process. So telling them that if something is uncomfortable at any point, they can raise their hand. Those techniques together work really well so that they feel sort of a control in the situation, and they can actually, calm down and know that if something is bothering them, they can let you know.
Perfect, thanks. Next one. What is your view on having the parents inside with the kid while having the dental treatment?
So in the US, it's actually sort of a debate, and it's a little bit of a mix between sort of a separation between the old timers and the new timers. I personally do have patients and the parents in the room. I do feel like from the patient's perspective, it doesn't, to me, make it much different. And from the parents' perspective, it's much less stressful for the parents. That being said, there are times where we're asking a parent to maybe stay behind the patient's head so that the patient has to focus more on me and my staff versus trying to speak to the parent, because that way there's less people involved. It's always better if it's sort of a one-on-one versus a patient talking to the mother who's then talking to you or talking to the father. So I do have parents in the room almost completely, but there are a lot of people that don't and are much more comfortable that way. But personally, I do have them in the room.
Same here. Even I have parents in the operatory room. So I completely agree with Dr. Eyal.
Next one. I understand that you try not to use sedation, nitrous oxide, but in which cases do you use it, and from what age do you recommend to use it?
I can start if you'd like.
Yeah, perfect.
In some offices, any patient who has any operative work gets nitrous oxide, at least. In our office, that's not the case. I don't do anything stronger than nitrous oxide, so we don't do conscious sedation or IV sedation. I'm on staff at a hospital for general anesthesia, but I haven't done a case in probably 3 years now. So I try to avoid anything if I can. That being said, we do have nitrous oxide in the office, but I don't have a general guideline. It's really case by case. So if I feel like based on the procedure that's going to be done and the patient's age and anxiety level, that it would be helpful, then we do recommend it. And if I feel like we don't need it, then we don't use it. So I don't have a specific guideline in terms of what age. Kids that are much younger, oftentimes it is a little more difficult just because they have to have the nose piece over their nose and they may not be comfortable with it. And you need to be nasally breathing for it to work. But I don't feel like there's any specific area where I'd say this is where you have to use it versus this is where you don't have to use it. That being said, the one area that I do find that it's very helpful, even though we may not think it's necessary, is patients that have a very bad gag reflex. So even if they're very well behaved and not stressed at all and totally comfortable, it does help suppress the gag reflex a little bit. And that was one of the things that always made me, have a tough time when I was a kid. I always felt like I was drowning or choking. So nitrous oxide can help that a little bit as well.
Yes, I completely agree with Dr. Eyal on this.
Perfect, thanks. How do you deal with long dental procedures? Sometimes kids don't really stay still during root canal treatment. How do you deal if they're in the middle of the treatment, the kids want to leave?
So yeah, I mean, when you know that the kid is getting irritated and is not sitting for long appointments, that's when you just give them a break, call them in the next appointment and complete. There's no hush to finish the whole treatment in one sitting. You can break your appointments and make sure that the child is friendly. The only motto to break up this thing is because we need to develop the trust between the patient and the doctor, that we are listening to all the orders or all the enhancing control technique wherein the patient is not happy sitting for a long hours. Respect that and send the patient back and call them in the next sitting and finish it off. So I don't think that I compulsorily make the child sit throughout the treatment. I don't. I give them breaks.
I definitely agree with that. The number one way I try to avoid having a patient have a tough time during a long appointment is I try to avoid having a long appointment. So we just try to schedule things from the beginning in shorter parts. And there are times where parents will ask to do more during an appointment. But the way I explain it to the parent is that for me, if I keep an appointment short, I'm pretty confident that I can get everything done without any stress to the patient. But once we try to do a little bit more, at that point, if the patient has had enough, now you're kind of stuck with being in the middle of an open tooth. And now you either have to put a temporary filling in or try to push past and do the work. So I think the best way to avoid that situation is try to keep appointments shorter if possible. Again, with root canals, those appointments are longer, but with the newer techniques in dentistry, and again, we didn't really discuss the clinical aspects, but I don't do a lot of pulpotomies anymore. We don't do a lot of root canals. There are a lot of techniques now that we can avoid them, again, if we get patients in early enough. So trying to sort of avoid it is probably the best bet versus trying to deal with it once it happens.
Perfect, thank you very much. Anything else to say?
Thank you.
Thank you.
Next one, how do you introduce the anesthetic procedure to the child?
I think we've kind of already answered something similar to this. That we discuss with the child, use distraction, euphemism, and tell show do and administer the local anesthesia.
One thing that I have found that also helps is I have seen videos where dentists tell patients to close their eyes while they're doing it. For me, I feel like it has the opposite effect. I'd much rather them keep their eyes open. If my patient closes their eyes while I'm doing something, I actually tell them to open their eyes, because when your eyes are closed, you're imagining the worst. You know, they don't really know what's going on. I do feel like it's important to keep the syringe out of their sight. And so I actually switch hands when I'm injecting, either righty or lefty, to try to make sure that they can't see it. But I don't think it's helpful to tell them not to look, because then they're wondering why are you telling them that? So again, you know, like we were saying before, preparation beforehand is really the key.
Also, you know, you have these camouflage, you can camouflage your syringes using those crocodile sleeves. Even that kind of helps in some patients.
Perfect, thank you very much. Next one, what tools would you recommend using when the tutor or parent is also anxious? There's evidence that parents' dental anxiety reflects on the child's oral health. What can we do to help them both?
As I said, first and foremost, treat the parental anxiety, because if parental anxiety is taken care of, the child's dental behavior will automatically shift and become positive. First, you need to talk to the parent, try and understand their anxiety, their apprehension, treat them, make sure that you sit and talk to them, and I think that will help. Automatically, the child behavior changes.
I agree completely. Nothing to add on that. That's really all it is. I remember when I was in residency, my director got a little upset at a mom because she was sitting in the corner and praying while her child was having treatment done. And so the director told her, like, you know, prayer is great, but you don't pray when your kid is going to get shoes on, right? So all you're doing is making them nervous because you're nervous. So it's really important to work with the parent beforehand.
Right.
Mm-hmm. And here's the last question. Is there any chance to have another webinar with the clinical cases? That's completely up to you.
So I'm actually working on making one now. I just have to figure out my schedule because I'm pretty busy these days, but I'm trying to make it happen. So it's possible.
Yes, from my side too. Even I'll try, and we'll just try them and make something really nice and come up with something fun next time.
Thank you very much. We'd love to have you both once again showing some clinical cases.
Thank you.
So, well, that's
Pleasure.
that for today. People are very grateful. They're putting really nice comments in the comment section if you want to read them.
Sure. Thank you.
It is a real pleasure for us to have you both here from so far away, giving a lecture here in Chile.
Thank you.
That's it, really. Thank you very much.
I appreciate it. Thank you.
Thank you.
Yeah, if you want to say or add anything else, or that's it.
That's it. I appreciate it. Thank you very much for making this happen.
Thank you, everyone.
Mm-hmm. Okay, goodbye, and I hope you have a nice week, a nice way back to working.
Thank you.
And let's hope we can see us soon in India or in USA.
Sure, sure.
Or maybe you can come to Chile too.
Possible.
Hopefully soon.
Absolutely.
Mm-hmm. Okay, goodbye. Thank you very much.
Bye.
Thank you. Have a great day.
Thanks, you too.